Okay, guys, happy Monday. Thank you for joining our February Q&A.
We started?
We are live.
Oh, awesome. Yeah, so what Ryan said. Thank you guys for joining our Monday Zoom. This is our month of February Q&A. So we try to do our Q&A one time a month and usually the last Monday of every month, unless for some reason we have like a product launch that's going to take precedence over that. So we have mentioned this and we've received a few questions, but the questions do not need to be emailed in. You can type them into the chat and we're going to address the few that we have, talk about a few that have also been repeat questions, and then we're going to go to the chat. So if you have questions, please write it in now and we'll start going through it. And this is a great opportunity, not only for you to get your questions answered, but also you might not think about certain questions that other people ask. And then they ask them and then get these answers and it really benefits you too. So stay on through the whole thing, even if your question does gets answered, because they will all help you. As well as if you don't get your question answered, that might mean that it's just too personal. And I would say go ahead and email me the question. That way I can respond to you directly. Or if someone jumps on late and maybe the question has already been answered, that way we don't repeat this and make this an hour long. Try to keep these about a half an hour. Okay. Ready?
I thought we tried to do 15 minutes, but I don't know that we've been.
It never,
Yeah.
right. We always try. Okay, a couple things that I just want to address that are just, it's also in our FAQ on our website, but pregnancy and breastfeeding. When it comes to this, I'm not saying that the products are not okay for pregnancy or breastfeeding, but you must speak to your OBGYN, your doctor, prior to supplementation. And that's the same thing that goes with children under 18. Currently, all of our products are formulated and dosed for children 18 plus. So if you have a child that's under 18 years of age, again, doesn't mean that these products are bad for them. It's just they're not formulated and dosed for them. So I recommend you speaking with your child's pediatrician, knowing that we do have a children's organic gummy multivitamin coming out soon.
I do. I hate that answer, but I know why we have to answer that way. It's like a legal protection disclaimer thing. Because if you're pregnant, if you're preparing for pregnancy, you need to have higher amounts of folate to prevent neural tube defect. I mean, that's a congenital birth defect that can be prevented with just adequate amounts of folic acid and B vitamins. Then, of course, there's DHA, one of the omega-3 fatty acids. Of course, you need that for healthy cellular development, brain health, brain development. But I hate the fact that, yeah, you have to check with your obstetrics or gynecologist or whoever, whatever. But it's just because that's the world we live in.
Right, right. And I can say personally,
I can
if I was pregnant or breastfeeding, I would 100% use them.
Yeah.
And likewise,
yeah, that would be a multivitamin in the factor 4.
Right.
But of course, you'd want more vitamin D, right? Especially if you're in the cooler winter months where you're not getting out, and of course magnesium, right? We know that pregnant women that have preeclampsia, like high blood pressure during pregnancy, are being given magnesium if they are admitted into a hospital,
right,
for blood pressure. It's part of 300 biochemical reactions. Of course, the fetus needs that magnesium as well. It's frustrating, but yeah, the children's multi has a good point, though. That will be an awesome
right. And again, not saying no to either of those topics. It's just you need to discuss with your pediatrician or your OBGYN prior to. Okay, essential oils being shipped internationally. We are working on this. It's a lot of hoops that we're going to need to go through if this is going to happen. And we didn't know how difficult it was to actually ship essential oils internationally, but each country has its own specifications, what kind of box it has to be in, what labeling, what certain, all different criteria. So just a process that we're going to work on and see how we can get there the best we can. Dosing of vitamin D. I don't know if you want to address this one, but obviously our vitamin D is 2,000 international units. That's for one capsule. Mind you, we do put 60 capsules in our vitamin D supplement because a lot of people do need more than that 2,000 international units. So if you want to keep it a 30-day supply, maybe you need 2. But this is based on your doctor's recommendations, really based on your blood work. So 2,000 international units. I'm sure Ryan will want to chime in on this more, but it's like the lowest dose that you can maintain a level of vitamin D that your body needs. So if you are really deficient, you're probably going to need to load that a little more to achieve the level that you want. And then you maintain that level with 2,000 international units. Anything to add on to that?
Yeah, have your levels checked. Even if it's just part of routine blood work, most docs are not ordering it. God knows only why. I have no idea. It's cheap. It's super affordable. Even if the insurance company doesn't pay for it, who cares? Pay for it. 2,5 hydroxy vitamin D is the test you'd want to get. And if you look at the ranges, again, it's just to prevent vitamin D disease, really. It's sad. It's actually quite pathetic how low the numbers are. You should be aiming for 30 to 50 nanograms per ml. Many practitioners in the functional space are saying get over 50 nanograms per ml. Some are saying 100. I am definitely not giving medical advice on saying get to 100. It is very high. Remember, vitamin D is one of the fat-soluble vitamins, so it can accumulate in our tissue and it can become toxic in very high doses. It can be hard on the body and the kidneys. So careful with vitamin D. That said is why we chose 2,000 units per capsule. So you have that flexibility. You can go to 4,000 if you're low, and then 2,000 should maintain you 2,000 per day. So 1 cap per day should maintain you somewhere in that range of 30 to 50 nanograms per ml. But if you're not there, get there. And for some people, do some research, but you might want to be over 50. Lisa's one of them. She wants to be over 50. I maintain right around 50 consistently, and I do about 2,000 to 4,000 a day, depending on my sun exposure, depending on my activity, all that. So 2,5 hydroxy vitamin D. Get your blood levels checked.
Okay, next, so we did have an affiliate write in a question about, it's called informed choice. So it's almost as if we have our labeling, if something is third-party tested, CGMP, NSF. This is just another one of those certifications. So Ryan will go into a little bit of the differences and why it's not necessarily necessary to add on to what we already have.
If you just Google Amazon contaminated supplements, you'll see a study that came out and it was like a crazy number high of how many products were adulterated. So they're contaminated with, say, in this example, banned substances. Typically, you're seeing banned substances in the weight loss category. So they'll add stimulants, sexual health, they'll add derivatives, or actually real Viagra has been detected in some sexual health products, as well as sports performance. So the International Olympic Committee, obviously collegiate associations, professional organizations, NFL, MLB, they're international. So they devised a way to test for banned substances. And there's a couple of different options. You can do NSF Sport, or you can do Informed Choice. They're both basically accrediting or certifying bodies that will test your supplement, say, oh, you're approved, you do not have any of the banned substances in it, so you can use their badge on your products. It's really about marketing and promoting. And of course, it's for the athletes to have peace of mind that there is no banned substance in those products. It's important. I agree that it's important. But what's more important is to be working with a manufacturing partner that does exactly CGMP. And CGMP is good manufacturing practices. It's continuous. It's always updated. And actually, the one that we use is under NSF. So if we so choose to put on NSF Sport, we could have our products tested for NSF Sport. The reason we don't do it is because we don't have any banned substances in our products. As a matter of fact, you'll see all the testing. The testing will show you everything. So they are already testing for contaminants and adulterants. So they're ensuring that what we say is in the product is exactly what's in there. So that's your identity. And then, of course, there's potency. So we're saying how much of what we put in there is exactly what's in there. And then, of course, purity. So we're testing for contaminants. And that's not just, we're testing for lots of contaminants, including molds, mildews, bacteria, metals, and such. So there's an extensive testing protocol under CGMP. Of course, these other companies that were putting banned products in there, of course, you can probably find some manufacturing facility that is willing to just do whatever to make money and get it done. That's greed. That's egregious behavior. It's not something we condone. I appreciate the fact that these agencies exist. It is a business model for them. And we just don't, at this time, we don't deem it necessary. We don't need it. We are confident in the purity of our products.
Okay. And last one for you to just touch on. We've touched on this before with methylene blue, but we get the common question about certain medications, typically the SSRIs, where the literature will state, to avoid methylene blue if on SSRIs due to serotonin syndrome, which is, yes, a real thing. But again, those are for, as Ryan always says, high doses of methylene blue, typically like IV form where it's going straight into the bloodstream. And that's, again, super high doses. Ours is the lowest therapeutic dose. We feel that it is safe to take safe and beneficial while taking SSRIs. But again, we always recommend discussing with your doctor.
Yeah. So you'll typically see, if you search that interaction, you'll see it referencing high doses, typically 3 to 5 milligrams per pound or something like that, something crazy, like 4 to 6, maybe even 800 milligrams of methylene blue. There is a big difference between those high doses and the difference of what we have in our single strip, which is 20 milligrams. The awesome part about it is the 20 milligrams still shows clinically efficacious dose. So you're still getting a lot of the benefits out of methylene blue at 20 milligrams without the need of having to titrate and go crazy with the amount that we're taught, that most of the studies have shown. Whereas, and methylene blue it's like I guess it's too technical, but it does drive serotonin. So if you are on a selective serotonin reuptake inhibitor, which is common for generalized anxiety disorder, it's common for mood depressive disorder. It's one of the most commonly prescribed meds out there. My personal opinion on it is that the benefit very much outweighs the risk. But of course, with anything I'm going to tell you, you consult with your medical provider, let them look at the research. If they say, no, I see too many drug interactions or flags, say, but can you check the dosing? Because I was told that at this low dose of 20 milligrams for methylene blue, the benefit most likely outweighs the risk. I mean, the same thing goes with some of the other health conditions that you'll see, some of the antipsychotic meds. And of course, you start talking about the benefits for neurodegenerative disease like Alzheimer's and Parkinson's. I just can't imagine why somebody would not want to try and to get the benefit from methylene blue. Again, the legal system dictates so much of what we're allowed to say and do. So,
okay, let's go quickly through some of these. Do you have a plan to have weight loss products? So we don't believe in like that quick fix of a weight loss product. You take a pill and you're going to lose 20 pounds.
Well, if you do, like some of the meds are out right now, like the GLP-1s, it has other unintended consequences that you need to be mindful of.
Right.
Like if you are on an Ozempic-like drug, know that you're depleting your body of other important vitamins, minerals, and nutrients you must be supplementing with. I just want to chime in. Sorry.
Right. Yes. So now I would tell you, if you are balancing your body with all of the nutrients and vitamins and minerals that your body needs, it will start to work for you and weight loss will happen. Yes. Will we work on a product that helps with metabolism? Yes, because sometimes we all need that little bit of a metabolism boost, especially if it gets into that sluggish state. But again, if it is a sluggish metabolism, that's all lifestyle. It really 100% is lifestyle. And I'm happy to help you understand how to lose weight with our products and with a healthy lifestyle.
Comment real quick on that. Yeah, like she said, with the metabolic support, that would not be like a thermogenic, similar to say caffeine and other stimulants, which you see a lot in the market with products. That's not a good, healthy, long-term solution. So she's right. It would be about lifestyle and improving your resting metabolic rate, basically what your caloric burn is, and it's a lot to do with lifestyle medicine. And we're definitely here to support you with that.
Yes. Would we ever come out with a liquid collagen? This is like
here we go. This is totally fuel for my fire. This is in powder form, which means it's going to be liquid by the time you consume it. Put a scoop in warm water, enjoy it like a tea. It's amazing any time of day. Not a fan of liquid. I call them aqueous preparations because they lack stability. I can assure you that any liquid collagen on the market right now does not have stability testing. Be shocked. Go ahead and ask your people for that. Say, hey, what stability testing do you have to show me that my product is stable, say after 15 or 20 or 30 or 60, 90 days later in solution. It's not going to happen. It degrades rapidly. Water is not a friend of most chemical entities. So powder is superior. It has the most stability. It doesn't degrade. It holds off. It fends off from bacterial contamination, mold contamination, mildew, fungus.
No preservatives.
No preservatives needed. Trust me, that's how drug suppliers do their stuff. They put it in powder form. It's shipped in powder form. It's held in powder form until it's prepared and
right. So what means your liquid collagen you may have been taking, that was once powder.
Yeah, of course.
Made into a liquid solution.
Yeah,
if you want to make it into a liquid solution, take the powder.
And then you have to preserve it. Then you also it's kind of crazy how much preservative they need. And a lot of times when we talk about like, is there preservative or how much preservative is in there? Because that's another thing, right? Like there might be like a little bit of natural flavor, but in a case like that might be a lot of preservative. So, and even though sorry, am I taking too long?
I feel like that.
Oh, sorry. Preservative is really just trying to preserve the product from contamination, not doing anything for stability of the product. They're not talking about managing the pH because collagen can be sensitive to pH. So long story short, I don't love it. I don't love liquid collagen.
I want to look further into it. We also have the our YouTube training on our collagen, and Ryan goes
All right,
into those
what's next?
details.
What's next?
In